You're watching Healthbeat, and we're looking into ways to make antidepressants more accessible. Currently, professional nurses in South Africa can't legally prescribe psychiatric medicines. But the country's latest HIV plan will change that. The plan says nurses have to be trained to prescribe meds for certain mental health conditions. But before that can happen, the law and a whole set of regulations need to change. Pharmacologist Andy Gray explains.
The first change that has to be made is that the Minister of Health has to change the regulations that govern which schedules the nurses have access to. Medicines that nurses can currently prescribe, predominantly in the public sector, that is limited to medicines in Schedule 1 to Schedule 4.
The higher the schedule of a medicine, the stricter the rules are for how it can be dispensed.
The simplest, the Schedule 0, are the medicines that you can buy in any retail store, in a spaza shop or a cafe. Then we get into increasingly strict control as the numbers go up. So Schedule 1 and 2, you can buy in a pharmacy. Schedule 3, 4, 5, and 6 require a prescription from an authorized prescriber, like a doctor. And then Schedule 7 are the ones that are banned.
Mental health drugs mostly fall under Schedule 5, which is why nurses can't currently prescribe them. Gray says changing the rules shouldn't take too long.
The normal process is that the minister publishes a draft regulation for comment, usually for a 3-month period, and then it gets finalized. This could be fixed in a matter of months if there was the political will to do it.
The minister doesn't decide alone. The Nursing Council, which oversees professional nurses' conduct, has a say too.
So in this regard, it has to make a recommendation on the wording of the regulations to the minister.
But the work doesn't end there. Psychiatric drugs need to be prescribed with the history of individual patients in mind.
So Schedule 5s have an abuse potential, not as strong as Schedule 6s, which would be something like morphine. But if you think of the medicines that we do use for anxiety, those can be misused by patients, and so there's stricter control over them.
This is why nurses will need psychiatrists to mentor them once they're allowed to give mental health meds.
And that mentoring is going to be really important, not only during the training, but as an ongoing referral mechanism for those nurses who will be asked to take care of patients with mental conditions.
Gray says updating regulations is only the first step.
There's also an opportunity for the Nursing Council to stipulate particular training programs for nurses who can then get entered into a specialist register. And we could then include medicines for those nurses specifically in the schedules. But that is a more complicated process. However, I think it's the right longer-term solution.